Now, doctor, can you talk to us about how these can lead to problems with our voice?
Absolutely. I think when you take a look at the first three, upper respiratory infections, inflammation, and vocal misuse, the underlying thing is inflammation for all of them. Upper respiratory tract infections, reflux, and voice use and misuse cause the vocal cords to swell, and that can cause you to have edema or swelling of the vocal cords, and they vibrate less. The other two, growths and cancer, are actually developments of vocal cords, actual masses that prevent the vocal cords from vibrating normally. And the neurological diseases, and the ones I think of in this case, can be either something that's like Parkinson's disease,
right,
which can definitely cause hoarseness. When you think of Parkinson's, you think of small steps, small movements, small handwriting, and lower voice, because there's a dysregulation or discoordination of how the vocal cords move. And then psychological trauma. There is a whole concept of functional voice disorders. I have a fair number of patients who have been abused, have had traumatic incidents, whether it's a surgery of the neck, such as a thyroid surgery, have had to be intubated for long periods of time. And because of the trauma, they develop basically anxiety about talking, and that can change the way they use their voice. They can lose their voice completely or have pain.
You can lose your voice from not using it?
You can use your voice from not using it, yes, not in the sense that you just stop talking and you don't use it, but if you're in a situation where you're intubated for a long period of time or have some other chronic illness, that can lead to it. But in the context of functional voice disorders, like we're talking about, the more psychological ones, that's usually someone manifesting stress. And the way I explain to my patients is some people manifest stress in different ways.
Right.
Some people have chest pain, some people have diarrhea, some people get skin outbreaks, some people lose their voice. And that can be hoarseness, or it can be, I've had one woman that didn't talk for 18 months, that was living in the islands. Every time she talked, it was complete silence. But she was able to get better with voice therapy and working through her psychological issues.